Hey guys, the Vertebros are back. Dr. Matt, Dr. Zach. We're excited to talk with you today a little bit about x-rays. So some people wonder, how important are x-rays? Do chiropractors need to take them when you first come in for an evaluation? And we will tell you, to see is to know and to not see is to guess. So we want to make sure we know exactly what's going on with the structure of the spine and the bony structures that we're looking at, because there's a lot of things that could go wrong if we don't know what's underneath the surface. I always say that I'm good, but I don't have x-ray vision. I can't just look at you and know exactly how your spine maybe has been damaged. So the best way for us to do that is allow us to take those x-rays to identify not only if you have areas that are off from position, but also to see if you have areas of degeneration. I'm sure as Dr. Zach could attest to, it's unbelievable how many people come into our practice who have forms of degeneration within their spine already, but they don't even realize it. So on a regular basis, we see if someone comes in with lower back pain, if we see on our different other assessments that there might be something going on in the neck, if it makes sense, we may take an x-ray, and 9 times out of 10, we actually find that there's usually curved dysfunction or loss of disc space, which is a really big problem long term. Right, Dr. Zach?
Yeah, absolutely. I think you touched on a couple of really key things there too, is that we don't really want to guess what's going on, because certainly we could have someone just come in and we could have them lay right on the table and we could do an adjustment, and most times would that be fine? I mean, probably it would, but we really don't know sometimes. So just giving us an x-ray gives us a good sense to see what does that structure of the spine look like as well. And not only are there more significant things like what your medical doctor probably would look for, they're going to look for things such as like fracture, maybe any more like significant pathologies that might work their way into the bone too. So it allows us to see if there's anything like that going on, because a lot of times you don't necessarily feel those things or know that they're going on essentially too. But that also gives us a chance to look at what do those disc spaces look like? Where are the spaces? How do the spaces where the nerves come out? How do those look? What do the curves look like too? Did you know that your spine actually has a couple different curves if you look at it from the side? From the front, it should be straight, and from the side, it actually should have some curves. So we want to see exactly what that looks like too. And then it really just helps guide our treatment to it. So like where we can adjust, is it safe to adjust, and what techniques we need to use too, so we can give you the best care possible.
Yeah, absolutely. So when it comes to getting chiropractic care, we think that x-rays are actually a must. It just allows for a chiropractor to really know exactly what they're looking at and the best way to take care of you moving forward. So when it comes to our office, we are all about making sure we know what's going on so we can help serve you better. Stay tuned to our next video, all right?